If signs like persistent tiredness, swelling, or unusual changes in your body hint that your kidneys aren't working properly, it's not something to ignore. It's your body's alarm system. This second part will guide you through what to do next and how to support your kidneys in recovering their function. When warning signs appear, changes in sleep, skin, breath, swelling, back pain, or unusual urine, it's essential to take action quickly. First step, schedule an appointment with a reliable doctor and request some simple blood and urine tests. A basic panel should include serum creatinine, blood urea nitrogen, BUN, estimated glomerular filtration rate, eGFR, and a urinalysis to check for protein, blood cells, or abnormal color. These tests can reveal whether kidney filtering is impaired and how serious the dysfunction might be. If any test shows reduced function or abnormalities, such as protein in the urine, your doctor might recommend further evaluation. This could include imaging scans like ultrasound or CT to look for blockages, tumors, cysts, kidney stones, or structural issues, and possibly a referral to a nephrologist, a kidney specialist who can guide you on specific treatment and support. Assuming you're starting with mild to moderate impairment, the good news is that early-stage kidney function can often be stabilized or even improved through lifestyle adjustments. Hydration is one of the most powerful tools you have. Drinking sufficient water helps kidneys flush out toxins and maintain proper fluid balance. I recommend aiming for half your body weight in ounces per day. For example, a 160-pound person should target roughly 80 ounces, or just over 2 liters. If you're on medications that affect fluid, like diuretics, talk with a doctor about the right amount. Next, focus on minimizing toxic stressors. Over-the-counter pain medications such as ibuprofen, naproxen, or high-dose aspirin can harm the kidneys over time, especially if used frequently. If you're using these often, discuss safer alternatives with your doctor. Alcohol, smoking, and exposure to pollutants or heavy metals, common in contaminated water or certain occupations, are also dangerous for kidney health. Avoid smoking entirely and significantly reduce or eliminate alcohol intake. Diet plays a major role in supporting healthy kidneys. Eating well-balanced meals with limited added salt, sugar, and processed foods reduces the burden on your kidneys. Include lots of colorful vegetables and fruits, especially those rich in antioxidants and water content, like berries, melons, peppers, and leafy greens. If your kidneys are mildly impaired, a plant-focused diet not only eases filtration, but supports overall metabolism, blood pressure, and cardiovascular health. Just be sure to monitor potassium and phosphorus intake if your doctor advises it, especially as kidney function declines. Protein intake should be moderate, not too high or too low. High protein from red meat puts stress on the kidneys, while too little can weaken your muscles and immunity. A balanced approach is 0.6 to 0.8 grams per kilogram of body weight daily. So for a 70 kiloliters individual, that's about 42 to 56 grams of protein per day, with a blend of plant protein and lean animal sources like fish, eggs, and low-fat dairy. Next, managing blood pressure and blood sugar is essential. High blood pressure is one of the leading causes of kidney damage, and uncontrolled diabetes accelerates decline. Keep your blood pressure ideally below 130/80 mmHg and maintain consistent blood sugar within good ranges. Regular checkups, home monitoring, and medications as needed can make a real difference in slowing kidney damage. Exercise supports kidney health too. Sedentary lifestyles slow circulation and create sluggish blood flow in the kidneys. Aim for at least 150 minutes of moderate aerobic exercise per week, walking, cycling, swimming, or dancing. Add strength training a couple times a week to preserve muscle mass, which also contributes to metabolic and kidney support. Go at your own pace and adjust activity levels based on symptoms like fatigue or swelling. Stress management is another key component. Chronic stress raises blood pressure and triggers hormonal shifts that can harm the kidneys over time. Incorporate mindfulness, meditation, deep breathing, yoga, or even enjoyable hobbies to lower cortisol levels, improve sleep, and support kidney resilience. It's also essential to address any comorbid conditions. Reducing inflammation from arthritis or autoimmune diseases, controlling cholesterol, and treating vascular conditions all benefit your kidneys. Coordinating between your primary care doctor, nephrologist, cardiologist, endocrinologist, or any specialists ensures each part of your health supports the others, creating a holistic approach. Now, let's discuss specific natural supplements that may support kidney health, but always check with your provider before use, or if you're using medications to treat kidney or blood pressure conditions. Cranberry extract is well known for urinary tract health. It can prevent infection and maintain pH balance. For someone with recurrent UTIs that tax the kidneys, a cranberry supplement or drink can be beneficial. Aim for 300 to 500 milligrams daily. Omega-3 fish oil, which supports cardiovascular health, also offers anti-inflammatory effects that may slow kidney damage. Take a high-quality fish oil providing 1,000 milligrams of EPA plus DHA per day. If you're vegetarian, look for algae-based supplements. Coenzyme Q10, KOQ10, supports cellular energy production, including in kidney tissues. Studies have shown CoQ10 may help preserve kidney function and improve blood flow. A typical dose is 100 milligrams twice daily with food. Beneficial herbs include astragalus and turmeric. Astragalus, used in traditional Chinese medicine, has shown promise in reducing protein loss in urine. Turmeric's active compound, curcumin, is a powerful anti-inflammatory that may help lower oxidative stress in the kidneys. Start with small amounts in food, or take 500 milligrams of curcumin twice daily with black pepper or fat to enhance absorption. But be cautious, herbal supplements can interact with prescription meds or worsen kidney function if used improperly. Consult your nephrologist or pharmacist, especially if your eGFR is below 60 mL/min. If your kidney function declines to moderate, eGFR between 30 and 59, your doctor may refer you to a renal dietitian. In this stage, you'll need more control over protein, potassium, phosphorus, sodium, and fluids. Working with a dietitian allows you to continue a healthy, varied diet while protecting your remaining kidney function. In some cases, medications to help blood pressure, AC inhibitors or ARBs, control diabetes, or manage anemia or bone metabolism will support your kidneys. These protective medications help reduce protein leakage in the urine or preserve kidney function. Do not hesitate to start them if your doctor advises it. They are powerful tools to slow further damage. If kidney function drops into severe impairment, eGFR below 30 or symptoms worsen, treatment may include planning for dialysis or transplant. But even at this stage, lifestyle and dietary measures can alleviate symptoms and improve your quality of life. The goal is not just prolonging life, but maintaining energy, independence, and well-being for as long as possible. Throughout treatment, regular monitoring is vital. Stay on top of your kidney markers every 3 to 6 months or as your doctor recommends. Early detection of changes helps adjust your plan before issues get worse. Keep an eye on blood pressure, blood sugar, weight, and signs of fluid retention or worsening symptoms like fatigue or swelling. Support systems matter. Sharing your journey with family and friends helps maintain motivation. They can also learn what symptoms to watch for and when to remind you to attend appointments or tests. Connecting with a chronic kidney disease support group, in person or online, offers encouragement and shared wisdom from others in similar situations. And if you ever experience any red flag symptoms, sudden extreme fatigue, vomiting, chest pain, confusion or shortness of breath, especially combined with decreased urination, it's time for emergency medical attention. These could indicate acute kidney injury or complications needing immediate action. Protecting your kidneys isn't just about avoiding disease. It's about nurturing a vital system that supports your entire body. Your energy, your mobility, your independence, and your future. Small daily choices, staying hydrated, eating well, exercising, avoiding toxins, and managing blood pressure and blood sugar, combine to preserve kidney function. If you start today, you can delay or prevent kidney decline, keep enjoying life's simple pleasures, and maintain the energy and freedom you deserve. You are your own best advocate. By paying attention to your body, testing when signs appear, and making supportive lifestyle changes, you're giving your kidneys and yourself the best chance at a healthy life. When your kidneys start showing signs of a problem, it doesn't mean you've already lost the battle. Your body is still fighting, and there's much you can do to support recovery. Once you've seen a doctor and completed lab tests, imagine you have a roadmap ahead, one filled with practical steps to help your kidneys regain strength and protect your health. Let's walk this path together. First, understanding treatment options is key. If blood tests indicate reduced kidney function, your doctor might prescribe medications like ACE inhibitors, ARBs, or sodium bicarbonate, depending on your situation. These medicines can preserve kidney function by lowering blood pressure, reducing protein loss in the urine, and helping restore chemical balance. Adhering to them consistently and working closely with your care provider is essential. Alongside medications, diet modifications play a powerful role. We've already discussed eating less salt, managing protein intake, and watching potassium and phosphorus. But let's go deeper. Removing added sugar and refined carbohydrates prevents rapid blood sugar spikes, protecting kidney cells from damage. Prefer whole foods, like barley instead of rice, vegetables instead of canned soups. Choose bread with fewer than 300 mg sodium per slice, and inspect pasta, sauces, and salad dressings for hidden salt or phosphate additives. To support kidneys directly, leafy greens like spinach and Swiss chard are rich in magnesium and antioxidants, without overloading potassium. Colorful berries, grapes, and cherries offer polyphenols that reduce oxidative stress in the kidneys. Steamed cauliflower, fresh herbs like cilantro and parsley, and winter squash deliver nutrients and maintain good fluid balance without excess sodium. Aren't you worried how these changes taste? A little creativity transforms bland into delightful. Spice with garlic, powder or fresh, ginger, lemon zest, turmeric, black pepper, or oregano. Use olive or avocado oil rather than butter or margarine. Make soups with bone broth and chopped vegetables, flavored with lemon and herbs. One of my patients shared, "I thought I'd miss salty foods, but once I learned to flavor with fresh herbs, food actually became better." Hydration remains non-negotiable. If your doctor hasn't advised otherwise, aim for at least 1.5 to 2 liters of water daily. Filtered or spring water is best. Add fresh cucumber, mint, or lemon slices for flavor. Sip steadily throughout the day. Avoid drinking large amounts too quickly, especially if you've suffered from fluid retention. Good hydration helps kidneys clear toxins and supports safe blood pressure levels. Regular physical activity is another cornerstone. Even gently stretching or taking 5-minute movement breaks during TV time can stimulate circulation and support kidney flow. Aim for 150 minutes of moderate exercise weekly. Brisk walking, swimming, cycling, gardening, dancing. Anything that gets you moving and breathing without strain. Incorporate light strength exercises twice weekly to protect bone and muscle mass. Sleep quality matters too. Good rest strengthens kidneys via hormonal balance and recovery cycles. If insomnia or sleep apnea affects you, treatment can make an enormous difference. Small improvements, no late-night screens, a cool and dark bedroom, relaxation blends like lavender oil and deep breathing can enhance sleep significantly. If sleep problems persist, consider consulting a sleep specialist. Stress can quietly damage kidneys over time. Even 10 minutes of meditation, prayer, deep breathing, or walking in nature can reduce cortisol and protect your organs. One study showed stress reduction techniques improved kidney function markers in people with chronic disease. Adding even one mindful break to your day, before breakfast or after dinner, can shift hormones back toward balance. Let's revisit supplements with new considerations for stage 2 or 3 kidney impairment. Along with cranberry, omega-3 fish oil, CoQ10, astragalus, and curcumin, some people include vitamin D3 with K2, magnesium, or B complex, depending on lab values. Low-dose vitamin D, for example, 1000 IU daily, supports bone and phosphorus balance. But kidney patients often need to limit potassium, phosphorus, and vitamin A, so any supplement must be cleared with your provider. Regular lab monitoring helps fine-tune your plan. eGFR and creatinine tests every 3-4 months allow early adjustments. Discussions around blood pressure goals, medication side effects, diet compliance, and lifestyle goals help keep you on track and motivated. Use home blood pressure monitoring, once daily, morning and evening, to stay informed and share results. Let's also tackle common misconceptions. One is that chronic kidney disease always leads to dialysis. In reality, up to 90% of people in early to moderate stages can maintain stable function for years without dialysis. Another myth is that only protein intake matters. In truth, managing blood sugar, blood pressure, hydration, inflammation, and toxins is equally important. When kidney function declines below eGFR 30, your doctor may discuss dialysis or kidney transplant. Even then, combining treatments with lifestyle, supplements, and emotional support greatly improves quality of life. Timely access to dialysis and transplant planning ensures you're prepared, not rushed if needed later. Many advanced patients still enjoy travel, hobbies, and independence with the right regimen. Sleep, eat, drink, and move with kidney health in mind. Tune into your fatigue levels, breathing, mood, body temperature, swelling patterns, and elimination patterns. Keep a symptom diary. When something new arises, feeling more tired than usual, waking thirsty at night, sudden swelling, log it and contact your team. Your body is sending meaningful signals worth attention. Hypothetically, let's follow Anna, a 68-year-old retired teacher with eGFR 55. Her labs show mild proteinuria and stage 3A kidney disease. She switches to unsweetened almond milk, fills her plate with vegetables and legumes, drinks filtered water, walks 30 minutes daily, limits ibuprofen, begins 100 mg ubiquinol and 1,000 mg fish oil, and checks her blood pressure twice daily. After 6 months, her eGFR holds steady. Her blood pressure drops from 145/85 to 130/75. Her energy returns and she no longer wakes at night with cramps. That's not magic. It's the power of a whole-body, consistent approach. If your journey calls for support, you don't need to do it alone. Close friends, family, support groups, health coaches, and dietitians form a safety net. Share your goals. Maybe it's to maintain independence, enjoy fall travel, play with grandchildren. When you treat your kidneys like an ally, not a problem, your mind shifts from fear to empowerment. It's never too late to act. Whether your kidney health is just starting to decline or you've been managing it for years, every ounce of care counts. You can't reverse decades overnight, but you can slow decline, reduce symptoms, preserve energy, and regain stability. You can take fewer medications, maintain hormones, sleep better, think clearer, and sustain independence. Every healthy meal, every glass of water, each 30-minute walk, every meaningful conversation, each sunrise you greet well. You're protecting your kidneys and nurturing your future. Let this next chapter be one of reliable kidney support, balanced health, and renewed joy in living fully. Celebrate your persistence, share your success and setbacks, and stay connected with people who care. Let every day count. Keep moving, keep thriving, and remember, your kidneys aren't failing, they're human. Give them a chance to heal, and in return, they'll give you a chance to keep living life to its fullest. Whenever you notice a change, just respond with intention. That's how you transform warning signs into steps forward, not backward.